Hello again, my name is Lisa. Thank you, Margarita. I'm working with SwissLens for since 2014 and in a position as CCO since 2022. And today I will present you some non-standard cases and solutions. Let's start with our favorite topic, myopia control. We know there's several options to manage myopia. Allow me to show you the options that SwissLens offers. Relax System is the general term of the group of products we offer for myopia control. As we learned today already, the Relax and Relax T is our soft lens for myopia management. Then we have, I just use my here. Then we have the Night Flex is for auto K with a special design, and the Relax Flex, spheric and toric. It's our daytime RGP lens, also with a special design with defocus. The special feature of our design are the possibility to change the optic zone and the peripheral defocus. What you can see here, for example, you can see here on the edge, this is not a topography after auto K. We see soft lenses, so it's topography made with soft lenses. Like this, you can see what kind of optic zone we have. So you can do it 5 millimeter, 4 millimeter, or 3.5 as you want. And this is a nice tip for you. When you do the topography with the lens, you can see where is the lens stabilized. So where is the optic zone? Sometimes we do fittings and we see it's all fine, but probably the zone is not right located. And like this, you can check it and improve your fitting. And here, we always say we can do like every parameter, but still I would like to show you our options. It's not only on relax system. Of course, I put here 0 for all lenses possible for spheric toric lenses. You can order, for example, lens with -8, cylinder -6, and you can choose your peripheral defocus. So it's when you take a standard lens with our calculator, we suggest to take 2.5, but you can always take what you want. And all those parameters you can get in 0.01 steps. Okay, and now let's talk about auto K lenses, Night Flex Relax. We know how it works actually. So let's take this case. For example, here you can see we correct, for example, -4. So we expect, of course, in the periphery, +4. But what happened with low myopia? Let's see it here. When we correct -1.5, of course, we have in the periphery plus 0.5, 1.5. So let's imagine a child with correction like this. Since the correction decreases during the day, the effective defocus for myopia control works only in the morning. So sure, with NightFlex Relax, we are able to induce the peripheral defocus independently of the correction and without overcorrection that patient. This is important. We don't want overcorrection. So the option is very helpful, not only for child, but also for patients who still have increasing myopia, such as the case from Victor. And here we have some links. You can see our videos, marketing videos on YouTube. You can use them for your patients, for example. If you want to have the video in good quality, you can always ask us and we will send it to you. Okay, let's start with our first case. Contact lens fitting after LASIK. We know that this patient got LASIK around 2019. At this time, she was 37 years old. And here, as you can see, she had this degree of myopia correction. So years later, she came up for checkup. What we did a topography, and we can see the LASIK was really well done. It's nicely centered with regular pattern. This is actually very important and helpful for us to be able to make a better lens fitting. So we have found out that her myopia had increased, not that much as you can see here, but still it was enough for her to seek help. Okay, so now take a closer look of this topography. Could the standard lens work here? After LASIK, peripheral area stays same, so we know it, but the center is strongly flattered. Choosing a standard lens according to the periphery gives air bubbles in the center and perhaps staying, so this is a bad fit. But choosing a standard lens according to the center will give us a big clearance at the periphery. Hoppla. Here. So the lens moves too much and it's uncomfortable. Patient cannot wear it. So how to calculate the lens with this kind of topography? Actually, it's very easy. You just need to follow some rules and use our website. So let me explain you. First step is to find the flattest radius on the ablation zone. Here, you can see it. We are working with millimeter and not dioptry. So for the calculation, we need to cover from dioptry to millimeter. This is easy. You can do it as well on our website. You can see here is our calculator. We choose just the flattest point and you write here the numbers and we get it in millimeter. But you can change it always on your device from dioptry to millimeter. It's actually also very easy. So now we know our flattest point. On the cornea, it's 9.12. And it's not that high, to be honest. Sometimes we see even 9.5, 10.2. So actually, it's fine here. Okay, how to calculate? We just add 0.3 to the flattest point to get our basic curve. That's all. And what we also need is the diameter, of course, of the LASIK zone. And you can measure it like this. I show you. Normally, it's something between 6 and 7 millimeter, but you can always measure it. Okay, to complete our calculation, we need the diameter of the lens. So how to do it? We just, here we have our cornea diameter and we add 2.5. And here we are, we have all data we need. We go online to our professional account. Here we have the diameter, we have the base curve, we have the optic zone and the sphere. The rest we calculate for you. So it's very easy to work with such a cornea. And in the end, what we get, the lens looks like a normal lens. It's well centered, comfortable, enough movement, and the vision was good. You can see here. But imagine some years from now, the patient came back with a new problem, presbyopia. In this case, our hydromet lens is available also in presbyopia design. So to close to the case, just remember you can get this lens in different parameter, high myopia or hyperopia, or what you have in all other lenses, for example, multifocal lenses, and just check all the information on our website. Or if you have some questions, you can ask us, and we will explain it to you. All right, let's continue with our last case. So this case is from Victor. We saw it already. We have already learned about it before. Hyperopia combined with high astigmatism and LASIK. We couldn't do the LASIK. In order to make a new fit, I did a new topography, of course, just to have something fresh. And you have here met a large area and enough data to make a calculation. So reviewing the full medical history, of course, of the patient, it turned out he has atopic eczema. So as we know, this could be linked by dry eye, but nevertheless, we start with soft lens. For the right, we use dose parameter. I took directly GM3 58. This is a material which we use for dry eye, and I took for the right one clear and for the left one blue. So I did the same with the left eye. Here you can see I took blue. So we have here the diameter, we have here the basic curve and all data. It was fine, the vision was good, it was comfortable, but only in the morning. It turned out he has really dry eye, so he couldn't wear the lens all the day. What we did, we switched to RGP lenses, our new Evo design. We heard about it from Thomas today. So we did the calculation. It's actually really easy as well. You just take, yeah, I show you, you take the flat and steep meridian to get the lens. You can go to the professional website, you put all the data in, you can use the calculator, and you can do simulations on the website with this lens. And here we are. The first lens we calculated, you can see, set perfectly centered. And we have a nice movement and it was comfortable. But what is also important for the toric contact lenses? It's a good stabilization. Here you can see. The fit is stable. You see the points here. And when the lens moves, it's always on the same axis. And here I put the topography from the right eye. Here you can see it's directly on the flat meridian. So of course the patient has the good vision and he could wear the lens full day. It was comfortable, good vision, so well done. All right, so how to order SwissLens lenses, how to order Hydramid or Relax, Nightflex, all lenses we offer. You just go to our professional website. You log in. If you don't have login, you just register and you will get your login data. Or you write us an email with all data we need. It's topography, refraction, what lenses you want, and or request order, and then we will help you. Also, you can do order with Medmont Media. We have a SwissLens button. You just press the button, put data in, and with one click you can do an order or request. And voila. So if you are not registered with us yet, you just go with the black QR code and you can see all our links for social media and for how to register. And here you can see all our seminars. And thank you for your attention. And I finish. Thank you.